Hey, this is Erin from Educated Nurse, and this is our last lecture in our series from ER nurse to breast cancer patient and survivor and back again. And this last one is probably one of my more favorite lectures, and I'm going to talk about and give some personal stories about my cancer journey and why it's important to speak up and advocate for yourself because nobody else will. So follow along. I do want to put a disclaimer out there that this video is for instructional purposes only. All right, so I want to just share with you some of the important aspects of speaking up, advocating for yourself, and if things aren't working or you're just not feeling like it's the best relationship, it's okay to get a second opinion. So the first story I'm going to share with you here is about myself. I was going through chemo, and I had just finished chemo, and I was getting ready to go do my double mastectomy, and I was sent to a very large, well-known level 1 trauma center in the Twin Cities of Minnesota. And I went in and they were going to set me up with some imaging, and I had asked them, please use my Portacath so I don't have to get, stuck with another needle for an IV because I was going to get contrast for my imaging studies. And they said, sure. And being a nurse, I knew what sterile procedure was. And as a patient, I was sitting there and I was watching them get set up to access my port. They never used sterile procedure. They never set up the equipment sterilely. They literally washed their hands, they put gloves on, and they grabbed a needle, and they were going to get ready to access my port. And I knew that what they were doing was wrong. I stopped them, and I told them, I said, you need to do this in a sterile fashion, and you need to use sterile procedure to access my port. And the imaging tech said, well, we never do it that way. And I said, well, I don't care if you never do it that way. This is what you should be doing. And I said, unless you're going to do it sterilely, you are not going to access my port. And they're like, well, this is how we've always done it. And I said, okay, I'm going to cancel my appointment for today, and I will go somewhere else, or I will come back on another day. I was livid. I was literally livid. I could not believe that they were not doing sterile procedure to access my port. As a patient who has no knowledge of medical things, they probably would have just let that happen. Being a nurse, I know that that was not right. Being a nurse, I spoke up for myself and I said, nope, this is not happening. As I was walking out to my car into the parking lot, I thought to myself, how many patients have they given central line infections to because they're not following sterile procedure? I could barely even talk. I was so upset. I called the radiology manager and left a message on the voicemail, and I called the patient advocate of the hospital. 2 weeks later, I hear back, and in the meantime, I told my oncologist what had happened, and I said, I need to go somewhere else. I'm not having my imaging done there again if that's their process. And again, this is a level 1 trauma center in the Twin Cities, okay? So I called the patient advocate. And I said, hey, this is what happened. Didn't hear from them, didn't hear from them, didn't hear from them. 2 weeks later, I get a call from the patient advocate again and the manager of imaging. They're all on the phone with me, and they say, Erin, thank you so much for bringing this to our attention. We did not have a process in place and a standard work for accessing ports and central lines. And I was just like, how can you not have a process in place for accessing central lines in a sterile fashion? This is like nursing 101, right? Unfortunately, the radiology department was not being run by a nurse or a physician or whatever. And so they never knew that sterile procedure needed to be done. After my incident and after I brought it to their attention, they changed their process. And they said, thank you so much. We have now created a standard work and we have changed our process. You have to advocate for yourself. No one else will advocate for you. And I don't know how many times during the process I thought to myself, think about all the patients that have no medical background. It scared me. The second thing here I wanted to just talk about too is getting a second opinion. Again, being a nurse, I don't know if that was a good or a bad thing, but I remember my first oncologist that I had she would get really irritated with me when I would ask questions. And I think she thought I was questioning her. And I wasn't questioning her. I was just simply asking to ask questions. And I would go home and I would do my research about the next chemo med that I was getting or about the next treatment I was getting. I would look up journals to make sure I was getting the most up-to-date treatment. And so when I would go back to her and be like, hey, can we try this, or can we do that, or have you thought about this? She would get super annoyed with me. And she finally got to the point right before I was going to start my last dose of chemo. And she said, you know what, Erin, if you don't like what we're doing here and you don't trust me, go get a second opinion. So you know what? I got a second opinion and I got a third opinion. My second opinion basically confirmed that all the things that we were doing were correct. And I really liked that doctor, but I didn't like how big of a healthcare system I would have had to switch to. I kind of felt like I was just like another cow, or, like a cattle barn, and people were just being, whisked in. You go to your appointment, you come in, and then you get spit out. I mean, I felt like I was just a number in this big healthcare system, even though I really liked the doctor. The third doctor that I saw is my current oncologist, and he is fantastic. He sat and he listened, and he knows that I'm a nurse, and so he'll ask me like what I want to do for treatment, and he allows me to ask questions. And I hope he's not doing that just because I'm a nurse. I hope that he's doing that with all of his patients, and I can't imagine he's not. But if something is not working for you, again, please advocate for yourself and get a second and get a third opinion. And if you are finding that you're not meshing well with your oncologist, find somebody else, because you will have a lifelong relationship with this person, and it needs to be somebody that you can trust. So these are my tips. Advocate for yourself. Please advocate for yourself. If something doesn't feel right, if you don't want to do something, don't feel forced. Do what's best for you. Take all the information that your doctors are giving you, do your own research, and then do what's best for you. I can't stress this enough. This is something that I'm super passionate about. If you have any questions, please feel free to reach out. Let me know. I'm happy to just chat with you. I'm not going to give you any advice, but I'm happy to chat with you. All my contact information should be on my site. Thank you for listening. This is something that I'm really passionate about, and is sharing my story. And like I said, if you have any questions anytime, please reach out, and hopefully you enjoyed it and you can share it with somebody else in your life who's going through the same thing. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.